as far as your personal experience in the midst of this, how has the pandemic sort of impacted your ability to treat and manage any patients you might be seeing? And then obviously you conduct research. Has it impacted the research side of your work as well?
Oh, yeah, absolutely. So, well, there are two parts to that. So in terms of the general management of patients, we've had to make way for patients coming into the hospital who experience respiratory difficulty. That means getting all of those other patients receiving regular care out back to the home. Sometimes they're not entirely prepared to transition back to the home, but we've made that happen over the last week. And it has been challenging to understand when there's a credible exposure and how to isolate one individual. That's obviously been discussed, very relevant to healthcare workers. Should anyone with a remote exposure but no confirmed direct exposure be out of the work schedule? That limits availability of care providers. That's going to be relevant in the home too for people with home nursing, who, whether there's someone that individual or someone in their family might have an exposure. So testing is really paramount to understanding whether exposure is real and whether someone should in fact be isolated. The unavailability of DNA-based testing or the lengthy turnaround time has made that not the most practical solution. There are now point-of-care tests for detecting exposure through the immune response, and another test that looks at protein components of the virus, an antigen test that is at the bedside or within 20 minutes a result. So that's going to be very useful, and you'll see these serological tests or antibody tests becoming more prevalent because they're a lot faster to turn around than the DNA-based testing for the virus itself.
And now, obviously, you mentioned sort of needing to get patients, out of the hospital. Have you utilized in any way telemedicine to sort of connect with your patients?
Oh, absolutely. That has, without the ability to quickly pivot into a virtual format, I think a lot of patients would have been left without access to their care providers. So in general, and some relaxation of the regulatory guidelines around that, ability to visit remotely with patients who are even not within the state, who are cross state boundaries or elsewhere in the country, that relaxing those restrictions has been important. And then certainly for the standpoint of the Health Science Center, even properly documentation and billing practices have been established to make sure that these visits are properly tracked in the medical record. And so having the ability to have an electronic medical record that integrates with the Zoom platform, which is secure for patient protected health information, that's been critical. So we have put that in place. Even all of our, you mentioned the impact on our science. Rather than face-to-face meetings, we've really used this kind of platform to establish a basis for continuing collaborations and even broadening our collaborative opportunities for people working on innovative approaches to solving this problem. We had a meeting yesterday among a half dozen folks prepared to roll out some of this antibody testing on site with the rapid turnaround testing platform that we developed.
And now, so was this, the Zoom aspect of care, has this been something that was previously already implemented that
It was established for a limited number of patients, and now we've gone completely virtual.
Okay, yeah, because you kind of wonder how easily a lot of hospital systems are adjusting to have to go entirely toward telemedicine in a lot of cases.
Yeah. It was not implemented in many places, but because of the network that it was established by the MDA, we're really leveraging the best practices experience that individual sites have that enable others to learn from that, and also expanded the MDA Resource Center, which has allowed care center specialists from around the country to call the Resource Center and get access to the latest information.